Good afternoon, everyone, and welcome to our last talk of the day. This is Dr. Christa North. She works at Supreme Fertility, and she's going to be speaking about fertility and your DNA. She has opened a private practice as a dietitian and has managed that for 15 years until the opportunity to join GeneWay, and Supreme Fertility came along. Thank you so much.
Thank you. All right, thanks. Yeah, thanks very much. Okay. All right, so obviously they've left the most important for last, and thanks very much for staying around. All right, so and I know they're also running a little bit late, so I'm going to try and make up for a bit of time in terms of that. So Supreme Fertility, what it's basically aimed at would be at couples specifically with unexplained, infertility. Also after physical causes of infertility have been excluded, preconception, to ensure optimal health. Before IVF, it has a very important role. And if people have got a personal history or family history of infertility and or miscarriages, and older people, are also really benefiting from this. So Supreme Fertility is a program that is basically looking at 3 to 6 months, and the reason for that is because it takes 3 months for eggs and for sperm to mature. So what you are doing today, is going to have an effect, in 3 months' time as well. All right, so we do know about all the different options, so we do know surgery, certain medications, and so forth. But Supreme Fertility is giving you another alternative, and it's another treatment option that we've got. So the difference between the Supreme Fertility program would then be the DNA testing. So we offer DNA testing for males and for females. And we look at 69 genetic variants that covers different areas from implantation failure, egg health, your thyroid, hormonal imbalances, blood clotting, detoxification, type of diet, certain micronutrients that you might need as well. But the big thing about this is that we then give you the solution to that as well, or rather your healthcare practitioner will give you the solution to that. And as an example, is if we look at something such as coffee, such as caffeine, we all wonder, is it good for me, or not? I'm sure you all would have Googled by now quite significantly as well to sort of say, and sometimes they say caffeine is good and sometimes it's not. Now, how caffeine is metabolized, so that's the normal physiology, how it actually works, would be certain genes that would program your body to detoxify and get rid of caffeine. And 2 of the genes that we test for that's got specifically to do with that are called CYP1A2 and NAT2. And if those genes have got genetic variations in it, it means it's very, very slow, so it can't metabolize it. So caffeine is going to basically be stuck, in your body, and that can contribute, to infertility. And that's why some people do benefit, from cutting out caffeine and others not. On the other hand, this is a gene, that actually is that the science actually recommends that you have, some caffeine as well. So there are far more, important genes than just these ones, but just to give you a sense of what it's about. Thyroid is critical for optimal fertility as well. However, and we do obviously test for some of those genes as well, but what is more important to know is that there is optimal ranges for normal fertility, for thyroid readings that differs from just the optimal ranges just for normal lab values, the standard as well. And if we do know that people have got an issue with their fertility thyroid genes, we know, first of all, you have to test it, but then what should the normal ranges be or the optimal ranges be, for you? Estrogen, so obviously the whole pathways in terms of hormones are quite important as well. And we look at the normal biological pathway. And if you know where in that pathway you've got genes that are actually not functioning well, it helps the doctor to target and say, but we know what we know, it's where the pathway might fall down is that transformation from cholesterol to progesterone, or is it from progesterone to testosterone, or testosterone to estrogens as well. So that gives the doctor, far better guidance, as to where to look for potential problems. Implantation failure. So there are a couple of genes that we are looking at in terms of that, but I actually thought I'll just show you one of them as well. This is a gene called mucin, and in essence what it is doing to make up the mucus, or basically the endometrial lining as well. And what must happen normally is that this gene is responsible to open up an area, in the endometrium that's going to cause that, the implantation to be successful. And we know that if you've got a problem with this particular gene, if the gene is overexpressed, in other words, it's on all the time, it's not going, to make space for that. But like all the other genes that we test, we know what to do about that. So that is just one of many of the genes that we are testing for as well. Some of you might know that there's also a male contribution to pregnancy loss as well. And that's got a lot to do with oxidative stress. So we basically have got two ways of dealing with oxidative stress. So we make our own antioxidants and we have to consume antioxidants as well. And if there's a problem with oxidative stress, the genes that must handle that, it definitely can contribute to problems with sperm health as well. That can then contribute to a non-viable, fetus. That can contribute to miscarriages as well. So this is just an example, say it's basically 50-50 that your body must make its own antioxidants, and the rest you actually have to get through the nutrition. An example as well is if we look at detoxification. If your body can't detoxify fluoride, it's going to have a direct influence on your thyroid that can then contribute to infertility as well. So that's one of the things that we are looking at. Methylation, you might have heard about methylation. Methylation is a process that switches genes on and off constantly. That is a normal process that must happen all the time. And it influences your body literally from top to toes. Now, one of many of the consequences of an abnormal methylation process would be high homocysteine levels. So high homocysteine it's a biomarker, it's a blood test that one can do, and high homocysteine is associated with problems with ovulation, poor egg quality, poor embryo quality, spina bifida, clubfoot, low birth weight, hypertension problems when you are pregnant, premature birth, congenital heart diseases, and unfortunately also miscarriages as well. And that is something that one can handle, quite easily to a certain extent, as well. So that's one of the processes that we are looking at. So Supreme Fertility have a step-by-step program that we only do through healthcare practitioners because it is a medical process as well. And but the big thing to remember about this is that we tell you what to do. So when you have that genetic deficiency or mutation, we say this is what the signs show, how you can overcome that particular genetic mutation. So this was just an absolute drop in the ocean. Our stall is actually just when you go out, you can walk straight into that as well. We do have a lucky draw as well for somebody today to actually win a DNA test. Okay, so I see my time is basically up. Any questions? Yeah, that you've got.